work?
I would like to tell you the legacy till 2005 in India. Instead of midwifery and OBG posting, male students were given in lieu of midwifery some other 12 courses. Okay, from 2005 only they started to getting the midwifery. That means in 2008 the first batch would have come out, the male nurses with the midwifery license. That means we are still very young, around 11 years old, 11 to 12 years old now. That change, that shift has to take place in the people mind also. And of course, in one more thing, our cultural diversity, and our men, and very well in northern part of India or in a community like Muslim community, and so many other religious based things are there. They don't want to be cared. So we need to give respect for individual preference of a women too. And there is no question they can work in the OBG ward, but how far they are skillful, that is also matters. Because I know, being sitting in as a registrar here, and when they are going for a delivery, and most of my teachers share with me, they just assist and they don't conduct the delivery as such. And I'm sorry to say, sitting at this position, but this is a scenario I think everywhere throughout India, because it has been restricted so much. And we need to think of a skill based also, and also cultural based also, and also the patient preference also. So these three aspects, if we could overcome, and definitely we can do it. Like how OG, you can just ask the same question with the doctor's profession. How many male logicians are there? See, in CMC Vellore, I studied from in 30 years back, and that time we had only one Dr. Bala, who was my logician too for my delivery. Okay, after that I never seen one or two. My daughter told me two are there. Not much of a logician in such a big reputed hospital too. And that is also their question, because our cultural background, which makes us giving a hindrance for us to work in such field. Of course, when they give, some of the time I felt much better with the male nurses approaching with the female patient, and even at the in the labor, when Dr. Bala was he was the one who conducted delivery for me. Such a support, rather than they understand very well and things. I do remember all my labor time, but it's good. But it will take time in our country. Definitely, it will happen, madam. It's just 10-year-old, young, very very young teething problem, male midwives, and they will come up, I feel. Thank you.
I am here again. Before we proceed, there are two questions which I come to my WhatsApp number too. I had also said that they had some issues from the Facebook Live to. They have two questions are there. Is there any relationship between the increase in the private nursing institutions and increase in the male nurses? Is it happened after? They are asking. It is a Karnataka example stating that in many nursing colleges, only few number of male nurses are allowed, not equal. So, is there any connection? How does that play a role? Over to you.
See, if you take a history, even in men nursing, for example, I told you CMC Vellore. They take, during that my time, they used to take 100 intake of diploma nurses. Okay, but they take only 4 male nurses. Okay, it was it was the history in the even the private sector. Even if you take government, I studied in Madras Medical College between 84 to 88. That was, we were the first batch of basic BSc nursing. That time diploma, simultaneously we were diploma school of nursing was there. For 100 student intake of Madras Medical College, they will have only 6 to 7 boys in a batch. So that means in government mission also they restricted the male entry, right? And some of the states, like I saw when I was referring in my journal and reference to give a lecture here, in Maharashtra they said 20% seat should be given to the male candidates. Not such rules are existing in Tamil Nadu, but I don't know about Karnataka how it is. But I can definitely say after the privatization, that is after 2003, the privatization, the really proliferation of private sector of nursing happened. In none other country in the world you see, here in this country, unfortunately, 80% is a private sector and 20% is the government sector. Whereas in other country, you see, it is only 40% to 30% is the private sector, 60% to 70% is a government sector, public sector. But in our country, it's just upside down. So that is also one of the issue to lobby with the government and go and represent. So here privatization happened, and a lot of private schools started coming in within the past 20 years. And they also, one way we should appreciate, one of the reasons this hike in number, like I told you, over the 60 years, we had only 1,470 males registered in this council. Whereas from 1999 to 2019, 20 years, we had around 12,000 male nurses registered with us. So you can see the big difference. If it would have been dependent only in the government institution, it wouldn't have happened. Private, one way it has helped us to have more number of male nurses. That is what I would say.
Yeah, thank you, ma'am. Before we, if we have any question, there is we have a series of sessions, webinar on this gender and nursing. We are now discussing only the male and female binaries, but there are also transgender and other people who joined as a factor of a sex we are discussing now. There are many factors of it. Follow to that, we have a one researcher who is done historical analysis of nursing movements in Delhi and Kerala. She has written a book. We are coming with her. She will tell what is it. Nurses were very aggressive, movement increased because of the male. That's the biggest question. She is looking at research very methodological way. She will be coming up. If you, there also somebody saying that tell us how to go legal ahead with that. So there is one more Supreme Court advocate who has agreed to come on the board and tell us the legal aspect of it, how it is going to happen. We have a series of webinars on this. Please don't stop asking questions. Please keep asking questions. Before that, there's an interesting factor which others who are on the dais, I would like to share with them in 2 minutes. I will be sharing this. This is, you all can access the data from WHO. I have collected from WHO itself, and the link is there here. Can you see my screen? Can you see the screen, ma'am?
Yeah.
See, now this data means different country wise, all the data's percentage, male and female, are there in different countries. See, India, first I took our neighboring state, Bhutan, 38%. If I go to the next slide, I'm not. Next slide, if you go here, Bangladesh, which is 22.55%, which is, we say Muslim country, regional based country, still the numbers are very high, maybe different reasons. See the Malaysia. Now, I was thinking, when it happened, I was looking at privatization and increase in what India we have seen. Same thing, if you see the countries which have given highest number of nurses to the world, in that comes India, Ghana, and Philippines. See the data here. The Ghana, which increased from 20 to 22%, but look at the Philippines. The Philippines data in 2010, there were only 22 point of nurses, male. It has reached to 70%. And if you see the international migration of nurses from the to the Western country, which is predominantly a phenomena, it has converted as a job creating profession majorly. That is the reason these patriarchal countries, men started to come in and join in. So one of the series, we are looking at this now, our team, there is one team who is looking after the comparison between the private sector and different country level. Should we look at the, what I want to communicate at the bottom line is, there is some connection between lack of economy in the country and woman being a part of the nursing. When the economy go down, the men want to join the job. The best option for them is care sector. Give across to nursing, which is very easy to join in because a lot of nurses are needed. Second, in the assistant care, the other care sector, like let us say nursing assistant or geriatric assistant, the numbers have been increased. this gender plays very important role according to economy too. With this, we will see if there are any questions. If not,
I will just would like to contribute one thing with you, Mr. Santosh.
please go
See,
ahead.
there is a study done, I think last week it was published, regarding artificial intelligence. In another next one decade, everything is going to be artificial intelligence. Whether nursing could be replaced by automated robots, and they said that nursing is the only field which cannot be replaced by automated robots because it has got a real nurses. We connect with people, we build the trust, and we give the care with the touch. So they have come out of the study. The nursing is the one going to be the biggest boom in the next decade and going to have much more job opportunity throughout the world. So I think I always say with the note, as long as birth and death is there is no question of unemployment for nurses. Only we need to grab the opportunity. Thank you so much, Mr. Santosh, for giving me such an opportunity. Thank you, dear participants.
Yeah, ma'am, before we conclude, you said about the intelligence. One of the great scholar who writes is this Harari. If you see,
Okay.
he is the internet, one of the artificial. If you see these 3 books, I was going through about caring sector, writing a chapter on it. So I have read his 3 books. Excellent. His first introduction itself, it has been said. I think it's important what point you brought out. Caring sector is ever ending. It will be never replaced by anyone. And this kind of developments, what's happening in India, need to be, we should be watchdogs where look up and question the, where there is something happening, we need to question with the evidences, not so simply telling them. I think thanks a lot for coming back, and in a short notice of 1 week of time, I sincerely thank Dr. Annie Grace for accepting invitation of all of us and being presenting excellent gender discrimination, which is male participation in nursing. Let me define like that. Let me come to that male participation in nursing, and that very historically in Tamil Nadu itself, which is the first council in Southeast Asia, what she was telling me when I started, which is, we are very proud of it. And added to that, how internationally so-called developed, economically developed countries could not, could also had same kind of discrimination till 1950s too. That's a thanks for it. I thank from this dais United Nursing Association Maharashtra, who has agreed to give a platform for Zoom platform to organize this session. Thanks to everyone. We see again the next session with a lot of issues related to it, and hopefully in the few months we will come out with the written, or whatever you have heard will be written there. With this, thanks a lot for being with us for 90 minutes. Have a nice day. Shabba khair. Bye bye.
Thank you. Bye bye.
Bye bye.
Thank you. Thank you, everyone.